All right, let's get started. Good afternoon, everyone. This is Frances DeVinny again. I'm Associate Director here with the Center for Public Policy Priorities. Thank you so much for joining us this afternoon for our State of Texas Children 2016 Race and Equity webinar. We are really excited to have released this work across Texas this year and to share it with you today. Just real quick, if you're having any trouble with the audio, here's some instructions. I'll leave this up here just for about 30 seconds so you can take a look at what you need to do to make the audio work, either through your computer mic and speakers or just to go ahead and dial in by phone. All right, I'm going to go ahead and advance it forward and let's get started. So thank you again to everyone for joining us today. We are really excited to be able to share with you some of the information that we've collected this year about how kids are doing in Texas, and specifically what are the barriers that may be in place for kids based on their race or ethnicity. What have we created based on our policy choices, based on our practices that enable or that lead to children having different outcomes, different well-being opportunities. We're going to talk about a lot of that data today, and we'll share with you at the end how you can find even more great information on our Kids Count Data Center website. So hang with us all the way through the end. We'll stop several times for questions throughout the webinar. Please type in on the left in the chat function if you have a question, and we'll save those and we'll bring them up when we stop for Q&A. Because we're anticipating having many people on the line this morning, which we're really excited about, we may not get to every question. If we do not get to your question, we promise to follow up with those of you who've registered for the webinar with some answers to both the questions we talk about today and the questions that we didn't get to. So never fear, we'll get back to you. And also I wanted to say a huge thank you to our sponsors for this report this year. The Annie E. Casey Foundation, the Austin Community Foundation, North Texas Community Foundation, the Early Learning Alliance in Fort Worth, the Boone Family Foundation, and Methodist Healthcare Ministries of South Texas. We couldn't do it without their support and the continued support of all of you who are the stakeholders and who use the data on a daily basis to help you do great work for Texas kids. Now, as I said, I'm Frances DeVinny. I'm the goofy blonde one at the top with the silly grin. And you'll be hearing from me for the first few minutes for introduction, and I'll be playing the MC this afternoon. And then I'll turn it over to our data expert, Jennifer Lee, who's the lead author on the report and really the data guru in the office, who'll be able to share with you what we've learned about how kids are doing in Texas, and then also answer your questions about what data we have available and how to use the data in the best way. Now here's our agenda for today. We're going to talk about the State of Texas Children data report that we put together. We're going to focus primarily on state level data, but I do want you to know that we also had several local reports specifically for Dallas, Fort Worth, and San Antonio that you can access on our website at cppp.org/kidscount. We'll show that website a couple of times and we'll talk about it a little more throughout. We'll also get to, at the end, showing you how to actually access a lot of even more data on the data center, the Kids Count Data Center. And we'll do a closing summary of what actually happened during our Texas Kids Count events and workshops and how we can be available to come and provide some data and information to you across the state for any conferences or meetings that you'll be having as well. Now just to give you a quick overview, the Kids Count project has been in place for over 30 years and is funded primarily by the Annie E. Casey Foundation. And its primary goal is to show how kids are doing across the country. And you'll be hearing in a few weeks about the National Kids Count Report, where it shows how Texas stacks up against other states, so keep your ears open for that. What we're sharing today is our state level look, which also provides data for all 254 counties on the data center website, including Loving, Little Loving that has 9 children. So we have data for all of those counties. And it's a really good look at how kids are doing on over 80 different measures of child well-being. And the main goal is to use data to help make really positive decisions, both in practice at the local level or in legislation at the state level, that has the best impact on kids and their well-being. Now you'll notice today that we have a space theme going on, and I wanted to share with you why we chose the space theme. Now it so happens that 55 years ago, this month, President John F. Kennedy actually went before a joint session of Congress to ask for money to help support the moonshot. And it seemed like such an unreachable goal, and yet when we focused all our time, all our energy, our collective belief that we could achieve this seemingly impossible task, we could do it. And this is one of my favorite quotes here. Now it is time to take longer strides, time for a great new American enterprise, time for this nation to take a clearly leading role in child well-being, which in many ways may hold the key to the future on earth. I believe we possess all the resources and talents necessary. Now you see what I did, didn't you? If you insert child well-being in there, everything still completely fits, and that's the goal we have. But this is also true both of the space race and of how we approach child well-being to date. But the facts of the matter are that we have never made the national decisions or marshaled the national, and I would say or state, resources required for such leadership. I believe, and we believe here at CPPP, that we can actually make Texas the #1 state for kids, and that is our moonshot. That is what we want this data to inspire us to do. That is what we believe we can do with good data and good decision making. And we're excited to be able to kick off this movement to try to make Texas #1 for kids. Now we're really curious right off the bat to see how many of you who are on the call today actually attended one of our April or May Kids Count events. So we again had events in Dallas, San Antonio, and Fort Worth. We'll give it just a couple of seconds. If you can click in there and let us know if you attended one of those three or if you didn't attend, please go ahead and click that. And we'll see some results. All right, we got a bunch of newbies on the line, I see. That's really exciting. I'm so glad to see we have some returning friends who did come to our Dallas, San Antonio, or Fort Worth events, but I'm even more thrilled to know that we are spreading the message even further with a bunch of new faces with the data today. So that's really exciting. Thanks for answering that poll. We'll have a few more polls throughout. Now I am really excited to switch it over to Jennifer Lee, our data guru and leader on the Kids Count report. If you still need to, if you're not hearing anything and you still need to log in, please call in on the phone line so you can hear, actually then you can't hear me telling you this, but you can see the number online. So Jennifer, take it away.
Thanks, Frances. Hi everyone. My name is Jennifer Lee and I'm a research associate at the Center for Public Policy Priorities. And as Frances said, the first part of this webinar I will be presenting some information from our most recent Texas Kids Count report, State of Texas Children 2016 with a special focus on race and equity. And then I'll move into a short section on how to navigate the Kids Count Data Center to access some of the data that we will be sharing in this presentation today. So the State of Texas Children report is a report that's part of the Texas Kids Count project, as Frances mentioned. If any of you are Twitter users and are better multitaskers than I am and can tweet and listen to a webinar at the same time, our hashtag there is KidsCount. And the goal of the Texas Kids Count project is very simple. It's just to improve child well-being through the use of data. So child well-being and data are sort of our mantra here at the Texas Kids Count project. So I want to start by introducing this journey metaphor and invite you to take a journey with me. We use this metaphor during our events in our journey all around the state this spring, traveling to Dallas, to San Antonio, to Fort Worth. And I like this metaphor because working towards racial equity and child well-being really is a journey. And we all come to this journey for various reasons. some of them very personal, and we were able to hear from some youth and people working all across the state on sort of what motivates them to enter on this journey towards racial equity and child well-being. It's also an organizational journey. The Center for Public Policy Priorities has been walking on this journey for the past year, working on this report. And we also discovered, visiting different communities throughout Texas, that it's a community-level journey. That different cities throughout Texas and the state as a whole are really on different places in this journey, and that's okay. That we're all in different places, that we come to this journey from different backgrounds and motivations, but that we're all here on this journey together. And that's really how it has to be for us to be able to improve child well-being and to achieve racial equity in our child well-being outcomes. Now, the vision for the Center for Public Policy Priorities is that Texas is a state where every child is healthy, well-educated, and financially secure. So that's how I'm going to be talking and structuring this webinar presentation today. We're going to talk about health, education, and financial security. And I know that there are a lot of other topics that we can't address within this short webinar today, and that also have to do with child well-being and racial equity, but those are the three that we're going to address today and is part of our vision for Texas Kids. Now, what does it mean to apply racial equity to this vision? Well, for us, it means being very serious about this part, that every child in Texas is healthy, well-educated, and financially secure. And that we are willing to change our policies, to commit the resources, and to adapt our practices to make sure that every child in Texas has these opportunities. I'm going to start today by talking about financial security. We believe that every child in Texas should be healthy, well-educated, and financially secure. Now, when we started looking at the issue of financial security and racial equity, we discovered that a lot of times the conversation starts here. Well, it's not race, it's poverty. There are a few things that I think I hear when I hear this statement. The first is that it's very uncomfortable for most people to talk about race. It's not a pleasant topic for most people. It's a painful topic for a lot of people that comes with a lot of negative emotions. So we would prefer not to talk about it and instead to focus on poverty. The second thing is that poverty is extremely important. It's one of the primary indicators that we look at the Texas Kids Count Project. It affects children's health outcomes. It affects children's educational opportunities and outcomes. It affects the financial security of children when they grow up to be adults. So it's an extremely important topic, and it's something that most people are working in this space are a little more comfortable talking about than race, so we focus on poverty instead. The last thing that we discovered is that when we start talking about race and financial security, people are afraid, especially when talking about using data and data broken down by race and ethnicity, that if we break down that data and see differences in child well-being outcomes by race and ethnicity, that the data will be used so that people will think that there is something wrong with certain groups of children, or that there is something deficient about certain groups of children. And that's a very important consideration to make. But I want to distinguish two things. First is that the way that data is used in analysis and how to, again, change our policies and change our practices is very different than how that data is communicated. So that's an important distinction to make. The second is that instead of jumping to the individual frame, it's important for us at the Center for Public Policy Priorities working in policy to think about differences in child well-being outcomes by races. What is going on with the policy choices and the practices that are contributing to the differences, instead of thinking about those things that we can change. So let me give you an example of some data broken down by race and ethnicity and how it is able to give us a much more complete and complex picture of what is going on with kids. This is a very common poverty statistic that we use. 25% of Texas children live in poverty. It's about $24,000 for a family of 4. But when we break that data down by race and ethnicity, we see that there are large differences in which children in our communities are most likely to be affected by poverty. So nearly 1 in 3 Black children in Texas, 1 in 3 Latino children in Texas are affected by poverty, and the rates are much lower for white and Asian children. Again, we were able to break down this data even further at the local level, and although there are patterns, there are also differences between different communities. For example, in Tarrant County, where Fort Worth is, the child poverty rate for Asian children is about 20%, for example. So there is some variation throughout the state. But we know that financial security is not just about poverty. Another common statistic that we look at is median income for households with children, which is about $61,000 in Texas. But when you break that data down by race and ethnicity, again, you can see that there are very large differences in the amount of financial resources that families have to be able to sustain themselves. And again, there are some differences throughout the state. For example, in San Antonio and Bexar County, the median income for Black householders with children is closer to $60,000. So there's some variation throughout the state as well. So instead of saying it's not race, it's poverty, I think it's important for us from the data perspective to say, let's look at race and poverty. And for you in your agency, it might be important to look at other data disaggregations as well. For example, gender might be an important consideration in the work that you do. Place or where a family lives, where they grow up may be important. And there are many other factors that we know affect child well-being, such as immigration status might be important for your work in particular, and that all of the ways that these interact are very important. So I'm just going to pause here for another poll question. So we're curious, of the following data breakdowns, which data breakdown is most relevant to your work? We're very interested in this question because we're continuously updating the Kids Count Data Center, as I mentioned, that we'll be going through at the end of the webinar presentation today. And this information will help us know which data breakdowns are most relevant to the users and potential users of the data center so that we can provide more data broken down by race and ethnicity or by other factors, age, gender, etc., on the data center. All of these breakdowns actually are available on the data center currently, but we'd like to see where there is the highest interest and need. So I'll just give people a few more seconds to pick the one data breakdown that is most useful to them in their work. And I'm closing the poll now, and it looks like a lot of you are interested in data broken down by race and ethnicity and also place or location. We have a lot of data broken down by county and also for some of our large cities in Texas. An age group is also one that's particularly interesting to folks. So that's good to know. We'll definitely take those results and use them for a breakdown in the data center. So I want to lift up actually a couple of these data elements here that we think are very important. The research shows are very important when we're talking about child well-being.
Hey, Jennifer.
Yeah.
Actually, can we pause real quick for a couple of questions?
Sure.
So we do have a couple of questions that will actually be a good segue for our next section. But there was a question about if you can explain why it's only 25% in poverty, but TEA reports that 66% of students are economically disadvantaged. Very sophisticated data question.
Yeah, that's a great question. So there are actually different measures. So when TEA reports students that are economically disadvantaged, that includes children who qualify for free and reduced lunch. And many of those students are not technically in poverty, but are slightly above the poverty line. So as the poverty line as measured by the federal poverty standard is a very, very low bar. So again, for a family of 4, that's about $24,000. So knowing that that level is very low and is based on a federal measure that was developed in the 60s, schools know that there are a lot of families who still struggle and would benefit from having reduced price meals or free meals provided at school, so that they allow students who technically live above the poverty line but are still low-income students to qualify for either free or reduced price lunch. So that goes up to about 185% of the federal poverty line. So when you see economically disadvantaged, that includes low-income students who do not technically live under the federal poverty line. Does that clarify?
Thank you. Yeah, that's a great answer. Thank you. Another quick question. Can you? There was a question about whether we include Native Americans in our data sets. Can you just very briefly tell people how we chose which categories we used?
Sure. So if you go on the Kids Count Data Center, which again is a national data center, there is some data available for Native American child populations. The data that we chose to use in our report was based on sort of what data was available and reliable for the different subpopulations of children that we see. Unfortunately, in Texas and throughout our local communities, the data on Native American child populations is often not available or reliable because the populations in most places throughout Texas are quite small. And so when we looked statewide, that's why that data is not included or subsumed into another group. That unfortunately we have to do that often with some other subpopulations of children, which in some communities is small, such as Asian, multiracial children. So those are some of the groups that sometimes are too small for us to unfortunately just get reliable data on. Data reliability is very important to us, so we try to be as consistent and use the data only when we're very confident in it.
Absolutely. Thank you, Jennifer. And we have another question that just asks about city or county data, so that's a good segue into the next section.
Okay, great. So there are a couple of these data breakdowns that the research lifts up as being particularly important for children. And again, all of these things are important and are important for various reasons, but there are a few that I just want to lift up right now. The first is place. Place matters so much for the opportunities and especially for the access that children have to things like good schools, to safe neighborhoods, and to access that their parents have to jobs, to banks, to grocery stores, the simple things that support families' financial security and well-being. Now the research shows that when high poverty neighborhoods in particular have difficulty in accessing a lot of these things that are important for supporting child well-being. And when we look at the long-term trends in the share of children that live in high poverty neighborhoods, we see that that number is growing. And I want to share this data here, which is actually taken from the Kids Count Data Center and breaks it down by city. You'll see here that in Dallas and Houston, about 37% of all children living in those cities live in what are considered high poverty neighborhoods. And then you can see that the data there also for other cities, Austin, Fort Worth, San Antonio. Two cities that are not included on this graphic but that are in the data center that I just want to share a little bit about because they have some interesting trends. In Arlington, about 19% of children live in high poverty neighborhoods, but it has experienced the fastest increase. So that's something to look for the community in Arlington. And in El Paso, about 25% of children live in high poverty neighborhoods, but it is actually the only large city in Texas where the share of children living in high poverty neighborhoods has slightly decreased over time, where in most cities we've seen that increasing, which is an interesting trend as well. So I want to share a couple of maps with you. We produce these maps for different communities throughout Texas. I'm just going to share the Dallas County map because I think it's illustrative of some patterns that we saw throughout the state. The first map is just a child population map. This shows where children of different races and ethnicities tend to live in Dallas. And you can see that white children, which are represented by that orangish-brown color, tend to live in the north parts of Dallas. Black children tend to live in the south parts of Dallas, and Hispanic children sort of live in the center parts of Dallas. And the second map that I wanted to share with you is a poverty map. And here census tracts are coded by the level of poverty that we see in the neighborhoods, and blue represents the very, very highest poverty neighborhoods. And when we compare these maps, you start to see some patterns on which children are most likely to live in the lowest poverty neighborhoods and which children are most likely to live in the highest poverty neighborhoods. And again, this matters because of what the research shows that highest poverty neighborhoods lack access to, and what the lowest poverty neighborhoods have access to. Now when we look across the state, we see that Hispanic children are actually the most likely to live in high poverty areas. 30% of Hispanic children in Texas live in high poverty areas, compared to just 4% of white children, for example. And it's important to recognize that policy matters when we look at these differences. None of these differences in where children and families live is entirely natural. They have been constructed by decades of policy decisions and practices that governments and people have made around, very explicitly around where families could live. And although that is a harsh reality to remember, I think it's important to acknowledge, because if we acknowledge the fact that policy had a role in creating a lot of these differences in where families had access to living, and in also the investments that were made in neighborhoods, policy can also play a powerful role in undoing those inequalities of the past. I want to talk a little bit about gender here, because I think the focus on policy and equity is particularly important when we look at trends on gender. I don't have slides on this, but I just wanted to lift it up. When we look at trends for women and financial security, we see that they have done incredibly well in a few areas, education, for example. But without a focus on policy and equity, we see that women have struggled in areas like poverty and financial security, because a lot of the policies that we have in place don't really fit the families of today. We see that although women have increasing levels of education, that a lot of the policies that we have today, or lack of policies, don't really support mothers and working families in particular. And for example, in our lack of child care policies or in workplace flexibility policies, a lot of these things that families have been talking about for many years. And so without that focus on policy and on equity, people can be working as hard as they can, but it's hard for us to see equitable outcomes. So I wanted to talk a little bit about that. We're going to move on right now to the next section, which is about health. But Frances, is there anything I should address, or should I continue with the health section?
I think we're good. Let's keep rolling.
Okay, great. So the second topic I'm going to talk about is health. And at the Center for Public Policy Priorities, we believe that every child in Texas should be healthy, well-educated, and financially secure. Health is actually the founding issue for the Center for Public Policy Priorities, and is an issue that we at the center care very deeply about. In health, there's a large variety of topics that we could address. Today, we're going to talk about health insurance. We're going to talk about maternal and infant health, and also a little bit about food insecurity. So those are the three topics that I'm going to address today. And when we look at health insurance, the reason we focus on health insurance is that health insurance is the primary way that families access health care in our current health system today, and it also protects families' financial security. Now, when we look at child uninsured rates in Texas, we see that they've improved for children of all different races and ethnicities, which is fantastic. We also see that the gaps between uninsured rates for white children and black children have closed throughout Texas, but that barriers still remain for Hispanic children in particular. I think this is a good example of why looking at race or immigration status is important in addition to looking at factors like poverty. When we looked at the child poverty rates on the earlier slide, you'll see that black children and Hispanic children had similar poverty rates, but here you'll see that Hispanic children's child uninsured rates are more than twice as high as black children. So what we've seen from communities and in research is that there are particular barriers, especially for Hispanic children who live in immigrant families, related to fears or misunderstanding around how being involved in public health insurance programs in particular might affect current or future immigration status. Language barriers are often an issue for immigrant families, both Hispanic immigrant families and Asian immigrant families, and just the familiarity of navigating a complex health insurance system can be very challenging. So that's a good example, I think, of how it's important to look at all of the data elements to figure out what's really going on with kids and families. Now, one of the things that could improve and continue to improve these uninsured rates is closing the coverage gap. Now, what is the coverage gap? The coverage gap is a situation that many individuals find themselves in when they earn too much to be eligible for Medicaid, but they earn too little to be eligible for financial assistance to help them pay for insurance in the marketplace. Now, estimates range between 766 and 864,000 adults in Texas fall into the coverage gap. And although the coverage gap only technically affects adults, we know that it affects children in many ways. The first is that we know from research that children are more likely to be insured if their parents are insured. So improving the adult uninsured rate, which is the worst in the nation, would help improve the child uninsured rate, which is also one of the worst in the nation. The second thing is that we know that health access for parents improves a couple of different things for kids. It improves their family's financial security, which affects child well-being. And we know that a lot of untreated physical health and mental health problems in particular are extremely important for child well-being and for child safety. One of the most obvious examples of that is when we look at the health of mothers and their children. These numbers that I'm showing you right now are the uninsured rates of women between the ages of 15 and 44. So that's the age group where women are most likely to be caring for children. And access to health care for women before, during, and after pregnancy is extremely important for the child well-being of kids and for babies. We know that not having access to health insurance is one of the primary reasons that women do not access prenatal care, which is very important. And we see that there are disparities in important infant health indicators when we break that down by race and ethnicity. When we look at premature births and the rate of premature births in Texas, Black infants are the most likely to be born premature. They're also the most likely to be born at a low birth weight, and also the most likely to die before the first year of birth. So there are very important differences when you break down the data at who is having the best start at a very early age throughout our state. And the last topic I want to touch on briefly is food insecurity. We consider food insecurity and nutrition as a core part of our health and wellness work. And from the data, we see that Black children and Hispanic children are the most likely to be food insecure in Texas. food insecurity is a symptom of financial insecurity. It's when parents and families struggle to put food on a consistent daily basis on the table for their kids. And it's extremely important not only for health, but also for the next topic that we're going to talk about, which is education. As mentioned earlier, schools have been a great partner in providing meals to their students in fighting food insecurity for kids. And it also helps, a lot of research has shown that being full and being fed is helpful for kids' education. It's easier to pay attention. It's easier to focus when you're not hungry. So I'm going to pause just a second before I go into our last topic, which is education, to see if I know there are many topics in health, and I just touched on a few briefly.
Yeah, so we have a great question. Can you remind people what is considered childbearing age and how that's determined or how that's defined?
Sure. So the age groups for childbearing age are 15 to 44. We selected that age standard based on some federal data from a survey called the SIP, and you'll see that there is a slight variation in what's considered childbearing age from different agencies. I know, for example, that the agency that works on homelessness in Fort Worth uses a slightly different age group. I think they might use might use like 16 to 44, but it's very similar when they look at their data and women of childbearing age who are homeless in their community. But that is sort of just based on some federal categories of what is considered childbearing age. But you can certainly adjust those age groups based on the data that's available for you. I think the most important thing to note about that age group is even if you cut it a slightly different way, so we've looked at other age groups for young adults, so 25 to 34, for example, but women of that age group in particular are the least likely to be insured in Texas. So we have relatively good insurance coverage for children and for older adults, but for women in the working age, sometimes called working age, 18 to 64 or 19 to 64, or childbearing age, or 15 to 44, the insurance coverage options are much worse than for children or for older adults.
And one other quick question, Jennifer, and then we'll move on to education. Can you talk a little bit about how schools can assist families getting involved with the school meals program? And we definitely have a bunch of resources on our website to help folks work through that process.
Yeah, that's a great question. There are a lot of different ways that schools and districts can make it easier for kids to access meals at their schools. First, there are several programs. So most people are familiar with the National School Lunch Program, but we've seen increasingly the use of the school breakfast program, where kids can access meals before school and make sure that they're ready for the school day. And we have a brief actually on our website at cppp.org that discusses some of the different models that schools have used that helps them best serve school breakfast and their experiences with those different serving models. So some schools have chosen to serve in the cafeteria, some have chosen to serve prepackaged meals in the classroom, and so there are some different options and lessons learned there on the website for schools that are interested in school breakfast. We also have a report on after-school meals on our website. That is a very new program that not a lot of schools and districts are utilizing right now. What we've seen a lot of schools and districts do is that the ones who are using after-school meals will partner often with an outside group such as Boys and Girls Club or something like that to do the after-school programming, while the school will figure out how to serve meals and snacks for kids who are accessing the after-school programming. So that's a great model of partnership where kids are getting either physical activity or academic enrichment activity, and then also being able to access meals when and supervision when they might not have that after school at home. So those are the three different sort of programs that are operated through our schools. Again, most schools in Texas are very good about offering the lunch program. I think almost all districts offer that, and a significant increase in schools that are opting for the breakfast program. And right now we are working on trying to get more schools aware of the after-school option as well.
Thanks, Jennifer.
So that's a good segue into our next topic, which is education. We believe that every child in Texas should be healthy, well-educated, and financially secure. And when you start talking about education and racial equity, a lot of times the conversation that has existed around racial equity in education floats towards something towards the achievement gap. So the achievement gap is a difference by race and ethnicity in some sort of outcome measure. For example, the outcome measure that I'm showing here is high school graduation rates, but it's also often a standardized test score, STAR tests, or if you're looking nationally at NAEP tests and looking at the different outcome measures on that. So we've seen here, this is the 4-year high school graduation rates. There are improvements for children of all races and ethnicities, but there are still some significant barriers for high school graduation for Hispanic and Black children in particular. Outcome measures are extremely important for setting goals and also for tracking progress towards those goals because we see racial equity as defined by when outcomes are equal for children. What's a little more difficult to talk about is the opportunity gap. And the opportunity gap is all of those structural things, the policies and practices, and all of those things that have happened before we get to the outcome measure. So that could be, in education, we see that health and differences in health access that often affect educational outcomes. Family financial security, high student mobility can affect educational outcomes. And some of those things are controllable by schools, and many of those things are not, although they can be addressed in certain ways. Now, one of the opportunity gaps that we see in Texas is around the financial resources that schools have to be able to educate their students. And I think it's important here to remind ourselves what was the motivation, a large part of the motivation of the most recent school finance case that we had, where over 600 school districts came to the state and said that they wanted the state to look at the adequate and equitable funding of our schools. Most of our school districts still mostly rely on local property taxes to fund their programs. And there are vast disparities in the levels of property wealth within districts. So for example, the poorest 20% of school districts had about $167,000 per student of property value in the district to be able to be taxed to raise money for the schools. And when you compare that to the wealthiest 20% of school districts, you'll see that's over $2 million of property value within the district. And school finance we do consider a racial equity issue. When you look at the different demographics of who attends the poorest and wealthiest school districts, we see that the poorest 20% of school districts, 74% of students are Hispanic. Statewide, a little over half of our students are Hispanic, so they're overrepresented. And then the wealthiest 20% of school districts, white students are overrepresented. Now, in the recent school finance ruling, in the statement that was released, the court said that Texas students deserved transformational change and a revamped system for the 21st century. They said that there was immense room for improvement in the way that we fund our schools. And I think they sent a clear message to the legislature that the ball is now in their court to make these improvements for our students, and that though the court said that basically the school finance system is sort of good enough for now, that students really deserve thorough transformational look at how we fund our schools, not just for now, but for what students are going to need for the future. So we looked at school funding as one of the primary opportunity gaps for students throughout Texas. We also looked at the school experience level on a couple of different factors that research shows is important for students' educational experience. One is teacher instability or high rates of teacher turnover. And Black students in Texas are the most likely to attend schools where there are high rates of teacher turnover. High rates of teacher turnover is expensive for schools. It's also very destabilizing for students. And the second factor we looked at are the levels of experience, and particularly first-year teachers in schools. And Black students are the most likely in Texas to be taught by the most in schools with high rates of first-year teachers. And white students are the least likely to attend schools with high numbers of first-year teachers. So I hope you get a chance to look at the report online because there is a lot more information there and the local reports have a lot more local data. I wanted to lift up a few of the policy recommendations that we have identified. There are a lot more recommendations in the report, so I do hope you get a chance to read them. But I want to talk briefly about a few of the high-level recommendations that we have.
Hey, Jennifer, before we go on to the recommendations, can we answer a couple of quick questions, one of which will transition us to the recommendations beautifully?
Sure.
So one of the questions was, what metrics are used to determine achievement, other measures that are used to determine achievement for kids in school?
So in Texas, our accountability system is based around STAR, which is a standardized test. We have a lot of STAR data available on the Kids Count Data Center, and there are many other different measures that we can use. I know that a lot of people are not necessarily don't love the STAR data, but it's important because it is the measure that the state uses to make a lot of important accountability decisions. So the STAR data we have available and is used widely. High school graduation rates are also used by TA. They have multiple ways of defining that. And so those are the sort of the primary outcome measures that are used from sort of a state policy level.
Thanks.
I don't know if that answers the question, but okay.
Yeah. And I'll just say real quickly, we've had a couple of questions about other topics that we don't address in the report, including criminal justice issues, though we do talk about school discipline policies in the state report, which is certainly related. And we also don't get into child welfare, although we completely believe that it's incredibly important to child well-being. The reason that we don't do that is because there are other organizations who do a really fantastic job in kind of taking a close look at criminal justice and child welfare. And we don't have current expertise on our staff to be able to talk about those issues. So that's one of the reasons we don't talk about it as much here. However, if you're interested in particular data, you should always feel free to reach out to us, and we'll help you in any way we can. The last question that will help us transition to the recommendations is talking about some of the data collection issues around, have you seen an increasing number of individuals who identify with, who don't identify with only one race, who may be counting as multiracial, and how are those accounted for in the data that we're sharing today?
That's a good question. There is an increase in the number and share of individuals who identify as multiracial. And I know that at the Texas Demographic Center, which is our sort of state branch of the Census Bureau, if you will, they've actually recently changed some of their methodology in being able to identify in births of parents who are multiracial. That I think is going to be an increasingly important category to look at in the future. Again, when we look at sort of the overall scope of things, it's still quite small overall, but it's certainly growing very quickly, the number of individuals who identify as multiracial. And we also know, particularly in the multiracial category, that there's so much diversity within that category. So I think that's, again, yes, it's very important. If in your agency or your program, if you're able to collect data that's meaningful about that category, I would encourage you to do so. All right, we need to move on because we're just running out of time here. But let me just talk about the policy recommendations, and then we're going to have to really zip through the data center section here, so I apologize for that. But the recommendations that we have listed up as our high-level priorities are first to collect, analyze, and use the data by race and ethnicity. So I'm glad someone asked a question about that. Sometimes that data is not available, but I know that for programs who do have that capability, it is very important to collect that data when available. A lot of times people will say, well, let's just skip that question because it's confusing or it's, they feel like it's uncomfortable. But if it is available, it's very important to use that data so we can really understand what's going on with kids and improve things for them. The second recommendation that we have, and there are a lot of things that can fit into this bucket, are supporting working families. We've seen an increasing need, especially for working families and for mothers, to be able to support families, especially with young children, around child care needs, workplace flexibility, to really give families that flexibility that helps support their financial security. And there are a lot of things that can be done both at the state and local level around this. Our third policy recommendation at the state level is to close the coverage gap. We know that many families can be helped by closing the coverage gap. Texas is the worst adult uninsured rate and is tied for last for the worst child uninsured rate. And this is one of the immediate actions that the legislature can take to improve that. And the last recommendation is school funding. The court has really said that the ball is in the legislature's hands and that it is their job to address this problem for Texas kids. So we encourage, we are going to keep working on this issue, and we encourage all of you who are interested in that to stay involved. Which brings me to our last poll question, which is around which of these four priorities are you most interested in advancing? You can actually select more than one if there's two that you're just dying to work on, but we're going to take this, if you click on a box, we're actually going to take that information and stay connected with you on the issue that you've identified that you're most interested in. And that's a way for us to just keep in touch with all of you on the webinar around the continued work that we're going to do on that and be able to provide some resources and opportunities in working to that. So I'm going to just give a couple minutes, and then I'm going to have to race through. And it looks like there's a lot of people interested in working on supporting working families, work supports, and that type of area, and then also school funding. So that's great. If you, we will definitely keep in touch with you about those issues as we continue to work on those issues throughout Texas. So for the second part of the webinar presentation, I just want to talk a little bit about the Kids Count Data Center. I'm going to go through this very quickly, but the data center can be found at datacenter.kidscount.org. And because I'm going to go through this quickly, I just want to let you know that for those of you who are interested, we have recorded a previous webinar that focuses specifically on how to use the Kids Count Data Center. If you go to cppp.org/kidscount and scroll down on that page, you'll see that there's a recording of this webinar. So you can go back and look at how to use the data center. And I would just go to the data center and play around. That's a great way to learn also. If you go to the data center, you'll see this is the home page, and there are 3 different ways to access the data. You can choose a state because it is a national data center, and if you wanted to look at something in Oklahoma, you could do that, but I look at Texas data all the time. You can also choose by a topic if there's something that you're particularly interested in, or you can choose characteristic. This is actually a new feature of the data center to look at those data breakdowns. Now if you went to the Texas page, what you'd see is just a list of all the indicators that are available for Texas. And on the left-hand side, you'd again see some of those options to be able to navigate. There's over 80 indicators. So you could break those down by topic, by location, by different characteristic. If you select, for example, race and ethnicity, it'll filter by the indicators that are available by race and ethnicity. So for example, if you clicked on children in poverty by race and ethnicity, maybe that's something you want to look at, it'll show you a table of the data, which is the default view. But there are a few other options to be aware of for visualization: maps, line graphs, and bar graphs. And I'm just going to run through what these are going to look at, what these are going to look like. You can create a map of children in poverty by race and ethnicity. Make sure to look at the top to know what you're looking at. This is Hispanic children in particular. You can look at line graphs to look at trends over time. And you can look in bar graphs to compare. Again, make sure you know what you're looking at. This here is the number, not the percentage of children who live in poverty by race and ethnicity. So check it out. It's at datacenter.kidscount.org, and there's a webinar that goes over all the ins and outs of using the data center that you can access through our website as well. And I'm going to turn it over to Frances to close in the last few minutes here.
Hi everyone. Thanks again, Jennifer. This has been an amazing presentation, and we've gotten a lot of comment over the chat box letting us know how powerful the information is. So I want to remind everyone that we absolutely will be sharing the recording of this webinar with you in an email follow-up, as well as links to the slides. So you will have access to that for your use. And I also wanted to let you know that, as I said, we have already done presentations in Dallas, San Antonio, and Fort Worth, but there is an opportunity on our website for you to request a presentation if you have interest in bringing this information to your local community. So please check that out. And then also I wanted to let you know that we are going to be hosting our Biennial Policy Summit November 30th and December 1st here in Austin at the Hyatt Regency. So put it as a save the date on your calendar. We will be sending out more information very soon about how you can sign up and what topics we will be covering. We're excited about bringing everyone from around the state together to really talk about how we can make Texas the #1 state, not only for kids, but for families and all Texans, so that everyone can be healthy, well-educated, and financially secure. Thank you so much for joining us today, and if you have any additional questions, please feel free to contact us. Our contact information is on the website, and we look forward to hearing from you, and best of luck in your data endeavors going forward. Take care everyone, and we'll connect with you again soon.